Good afternoon, Collins Marley. Let's begin the warm-up session. Which is your favorite destination? Why?
My dream destination is Australia. The first and foremost thing is that Australia has a world-class healthcare system, and I can be a part of it. Secondly, the country has a better standard of living and economic and political stability. Besides, here, nurses are paid well and respected too. In addition, I have many friends and relatives over there, so they can help me during my initial days.
What is your career goal after reaching your dream destination?
Right now, I do not have any clear management goals. I am very interested in learning about management and leadership, and would be interested in any committees that I could participate in and learn. I have lots of ideas and would love to be in a brainstorming group, and I am very interested in the management dynamics of the organization. I feel that I need to join leadership groups to learn and meet new people.
What are the qualities that a nurse should possess?
Of course, a nurse should possess a variety of qualities. First of all, she should possess excellent communication skills, which help them not only to gather clinical data but also to maintain an effective relationship with other team members. Secondly, problem-solving and critical thinking skills are essential for nurses to deal with emergencies and difficult situations. Other qualities such as punctuality, dedication, honesty, and competency are also pivotal for nurses.
What are the different roles of a nurse?
A nurse plays different roles in her profession. The primary role of a nurse is a caregiver. Apart from this role, she functions as a mediator, advocate, counselor, educator, and the like. A nurse plays a very crucial role in the healthcare system, connecting various departments in the industry for the welfare of patients.
What do you find rewarding about being a nurse?
I truly love helping people, and the most rewarding thing for me as a nurse is seeing the joy of patients and their families. It is always a priceless feeling to see our patients recover to a normal life after going through a difficult time. Throughout my years as a nurse, I have seen many heartbreaking times as well, and being able to help those families cope with loss has been very difficult but also rewarding.
Your preparation time is over. Please start your OET Speaking roleplay.
Good morning. My name is Hilton Johns, and I'm one of the nurses here at the Women's Health Clinic. I'll be helping you during your visit today. Before we begin, can I just confirm your name, please?
Good morning, Hilton. I'm Mihiraa.
Thank you, Mihiraa. You look a bit uncomfortable today. I'm sorry you're feeling this way. If it's all right with you, I'd like to start by understanding what brought you in today. What's been bothering you?
Lately, I haven't been sleeping well at all. I feel exhausted all the time. I need a professional medical assessment.
I appreciate your decision to seek medical attention, Mihiraa. First, could you please tell me about your symptoms?
Sure, nurse. I wake up drenched in sweat at night, and I keep getting these hot flushes. And my periods. I haven't had one in about 3 months now. It's all been quite scary, honestly.
Thank you for sharing that. I can imagine how distressing it must be to deal with all of this at once. Can you describe your symptoms in more detail? Specifically, when did they first start, how long have they been persisting, and how severe have they been?
Well, it started about 2 months ago. I fall asleep without much trouble, but I wake up 2 or 3 times a night, usually because I'm sweating or feeling too hot. Then I struggle to get back to sleep. The hot flushes actually began earlier, around 3 months ago. At first, I thought it was just the weather, but they kept happening. My face and neck get really warm, followed by intense sweating. It's much worse at night. I wake up completely drenched. My menstrual cycle used to be regular, like clockwork every month, but then it suddenly stopped. No spotting, no signs, just nothing.
Thank you for being so open about what you're experiencing, Mihiraa. I know it's not easy to talk about these kinds of changes, especially when they feel so sudden and overwhelming. But I want to reassure you, what you're going through is actually more common than many women realize, especially around your age. It's not unusual for women in their mid-30s to start noticing changes in their bodies that seem confusing at first, like hot flushes, night sweats, missed periods, and even fatigue or trouble sleeping. These symptoms can feel alarming, but they're usually not a sign of anything serious or dangerous. In fact, in many cases, they're part of a natural phase in a woman's life called perimenopause. Perimenopause is the body's transition toward menopause. It doesn't mean menopause is happening right away, but rather that your hormones are beginning to shift. These hormonal changes affect the body in many ways, and they can lead to the symptoms you've described. Some women start this transition in their late 30s, others later. It varies for everyone, and that's completely normal. What's important to remember is that these symptoms, while uncomfortable, are usually manageable with the right support. They don't mean something is wrong with you. You're not alone in this, and there are clear steps we can take to help you feel better. We'll figure this out together, one step at a time.
All right, hearing this gives me some reassurance. But nurse, these symptoms are really distressing and affecting my comfort. What can be done to manage them and improve my quality of life?
I'm really glad you've come in to talk about this, Mihiraa, because there are definitely ways we can help you feel more in control of these symptoms. While the changes you're going through are natural, that doesn't mean you just have to put up with them. There are a number of practical things we can try that many women find helpful, and we'll tailor them to what works best for you. Let's start with lifestyle changes. One of the most effective ways to reduce the intensity of symptoms like hot flushes, fatigue, and sleep problems is regular physical activity. I'm not talking about intense workouts unless that's something you enjoy. Just gentle movement like walking, yoga, or swimming a few times a week can make a big difference. It helps balance your mood, supports better sleep, and even helps with energy levels. Managing stress is another key part. Stress can make hot flushes and sleep problems worse, so finding small, regular moments to unwind can help a lot. You might find things like deep breathing, guided relaxation apps, or even just a quiet walk helpful. It doesn't have to be complicated, it just needs to be something that gives your mind a break. Now, about the hot flushes and night sweats, there are a few simple strategies that often bring relief. Dressing in layers during the day means you can remove a layer quickly if a hot flush hits. At night, using light, breathable bedding and keeping a fan or the window open can keep your sleeping environment cool. When it comes to sleep, building good sleep habits, what we call sleep hygiene, can make a big difference. Try to keep a consistent bedtime and avoid screens for about an hour before sleep. Also, avoid caffeine and heavy meals late in the evening, and if you can, wind down with a calming routine like reading, listening to soft music, or having a warm shower. These might sound like small adjustments, but they can really add up when done consistently. Do you have any other concerns?
I can try those. I hadn't thought of some of that before. I'm just worried it might not be enough. What steps need to be taken to achieve a full recovery?
That's a valid concern. Mihiraa, based on your symptoms, it's very possible you're going through early hormonal changes, like perimenopause. But to be sure and to rule out other causes, it's important to see a gynecologist. They can give you a clearer diagnosis and guide the right management for you. The next steps involve booking a consultation with a doctor to discuss symptoms and medical history. Based on the assessment, tests like blood work or imaging may be needed for diagnosis. Once results are available, treatment can begin, including lifestyle changes, medications, or therapy to manage symptoms and improve well-being.
That sounds like a plan.
Mihiraa, I can help arrange that consultation for you. Would that be all right?
Yes, please. I think that would give me some peace of mind.
Perfect. I'll go ahead and book that for you. We'll work through it together and make sure you're feeling supported at every step.